Hi, everyone. I'm Dr. Sheila Segerson, the Director of Outreach and Research for Maddie's Fund, and I'll be talking to you about care pathways specifically as they relate to behavior today. When I talk about care pathways, I like to spend a minute talking about the bigger picture, and that care pathways are only a small piece of the puzzle. And when we are working to support the animals in our care, there's an involvement of our community, our animal shelter, and very, very importantly, the culture of both of those, shelter and the community. And all those things need to be in place and supporting each other to get to where we need to go, and lots of programs in place to get us there. And Care Pathways is one of those programs that can help us improve the way we care for our animals. And that's what I'm going to talk about. So Care Pathway is at its simplest a set of management guidelines. Oftentimes it's in the form of a flow chart with regard to human medicine, but it's applied to a group of patients who have the same condition, a tool used to improve quality of healthcare. Often in human medicine, it's best practices approach. So taking what has been done in the past and what has been demonstrated to be effective to develop plans that support people. The use of care pathways in people has been associated with reduced in-hospital complications and strong positive effects in terms of impact on safety and the quality of care that people receive. A study done by Van Herk found that 65% of studies on care pathways indicated a positive effect on clinical outcomes, while 32% had said there was no effect. So in many, many cases, care pathways help to improve outcomes. And there is a link about an article about care pathways in humans. Care pathways, whether they're in people or animals, help to support beings on their journey. And any condition or disease, there's a continuum of it. And that most of us start off as healthy, and then things happen over time that make us at risk for disease developing. So early in the stages of a care pathway, we're focusing on doing everything we can to reduce those risk factors. Whereas once we're dealing with advanced disease, there's a lot of intensive management. So depending on where an animal is, our focus is going to be different in terms of how we support them. So here's an example of one of those flowcharts that I mentioned with regard to care pathways in people. And so this one is a care pathway for diabetics. And you can see the different steps: identifying people who are at risk, managing that risk, and preventing. And once people have type 2 diabetes, there are lots of different things, and they're outlined here on the slide that you can see, to help people keep people healthy for long periods of time. So this is a broad outline of what a care pathway can look like. I want to specifically talk about care plans as well, and that's care pathways are ways to manage an entire population of people who have, or animals who have, the same condition, whereas care plans are individualized. So if I have diabetes, I will be on the care pathway for diabetes, but I also am going to have a care plan that helps me as an individual to manage my disease, because my needs are going to be a little similar to another diabetic, but probably a little bit different. So care plans fit underneath care pathways and help us to be able to care for ourselves better. So that was a really brief talk related to care pathways in human and background. The rest of this is going to be talking about care pathways in animals. And I just love this sad looking kitten. She's so cute, or he. So care pathways, do you think your organization would benefit from care pathways? It's pretty clear in my eyes that most, if not all of us, would benefit from care pathways, because they can help things like reducing length of stay in the shelter, reducing physical and mental deterioration, making sure that the care that is needed is provided in a more timely manner, and increasing life saving. Those are just a couple of the examples of how care pathways can benefit our population. If you have questions as I'm talking, there will be time for me to answer the questions at the end. So please type your questions into the Q&A area. So there are steps to developing a care pathway system, starting with identifying gaps in your systems, identifying gaps in how you're caring for animals, and using care pathways to fill in those gaps. That's step one. Step two is developing the actual care pathway itself. So what is that care pathway going to look like? I'm going to give you examples of one. The third step is developing a plan to figure out how you're going to assign animals to care pathways. So with something like diabetes, it's easy. We test blood glucose and we do urinalysis. We diagnose diabetes. When we're talking about behavior, sometimes it's not quite as simple to assign animals to different care pathways. So we'll talk about that. And then step 4 is implementation. So we're going to run through these 4 steps. So step 1 is about identifying gaps where if we've decided that care pathways are something that are going to help our population, where do we need the most help? Where do we want to begin? Do we want to begin with general categories of care, or do we want to start with a care pathway for a specific issue that you have a lot of challenges with? So I know an organization that started one with parvo for puppies. So deciding what you begin with related to care pathways should be based on an evaluation of where there is the most need with regard to either life-saving, length of stay, welfare, or some other factor that you've identified. At this first stage is also, if you're not leadership yourself, at this first stage is also the point where you should be talking to the leadership at your organization to get buy-in to this idea and concept, to get this on board so that you're all moving forward on the same path. So when we're talking about care pathways, we're talking about efficiency of care and devoting resources to those who need those resources more, and not spending a lot of time and energy on animals who are going to get adopted really easily. It's not that we're not meeting their needs, but putting more resources into the animals that are identified as needing a little extra help. If that makes sense. So step 1 is about identifying gaps. Step 2 is about developing your care pathways with your goals in mind, whether it's improving quality of life or something else. So I'm going to walk you through an example of a care pathway system to show what it looks like for one organization that developed them. Sorry, just thinking of the best way to describe this. This care pathway is a general care pathway for dogs in this animal shelter, and that they wanted to try to make sure that they were meeting all the dogs' needs, but these dogs have a lot of needs, right? And so how are they going to divvy up who gets what to make sure that they're meeting the dogs' needs? So this shelter had 3 levels of dogs, level 1, 2, and 3. I want to be clear that these level 1, 2, and 3 classify dogs into areas for need. I'm going to talk about how that classification happens after I go through this care pathway, but classify according to needs. And it's a dog who is a level 1 dog is an easier dog to find a home for. And that this is a dog that appears to be behaviorally healthy and not have any challenges. Whereas a level 2 dog is a little bit more challenging for this particular to adopt out. And a level 3 dog is a dog who needs a lot of support to ensure success and happiness in a home environment once they get adopted. So our level 1 dogs at this shelter, it's not that they're being ignored, they just get less resources than the others. So you can see that we're providing all the basic things to level 1 dogs, and the care pathways are ensuring that all of these needs are being met. So things like adequate shelter, food, water, a bed, light, dark cycle, things like that. Our level 1 dogs also get enrichment. They also get a photo and bio on the website because that is necessary to get them adopted. Their welfare is assessed to make sure that they're doing well, because if their welfare starts to deteriorate, that's when they get moved up to be a level 2 dog because they need a little more support. They get out of their kennel at this shelter 3 times a day for walks and play group, and they have regular time with people, both quiet time and active time. So that's an example of a level 1 care pathway for the dogs who don't need special help. Whereas our level 2 dogs are dogs who are normal dogs, but might need a little more support. So these might be excitable dogs, or dogs that many people call jumpy mouthy dogs. These might be dogs who have some fear. These might be dogs who have milder behaviors that are normal for them, but can be challenging to manage, especially in a shelter environment where they are stressed. So at this shelter, the level 2 dogs get basic training. The level 1 dogs would get basic training too if we had enough resources, but the reality is that we're all strapped for resources, right? So this shelter elects to do the training with our level 2 dogs. These dogs are eligible for these different programs that I'm going to talk a little bit more about shortly. And also, we're regularly reevaluating their needs to make sure they're still a level 2 dog and haven't moved to level 1 or level 3, and also giving them a care plan if needed. So as an example, if it's a jumpy mouthy dog, we might also have a care pathway for a jumpy mouthy dog, and that dog's care plan then also includes jumpy mouthy dog care pathway. Hope that makes sense. So Virtual Foster, this is a program at Austin Pet Saliva, a program that used to be at Austin Pet Saliva. I don't think it's active anymore, actually, but there's a really good webinar about this program with the link here to Pedigree Foundation. This is basically an advocacy program where staff and volunteers can sign up to be a virtual foster for dogs in the shelter's care. And these people provide extra support in terms of marketing, whether it's pictures, writing bios, taking the dog out on field trips, providing extra behavior support. So they're often the trainer if the dog would benefit from training, helping to communicate with adoption inquiries, things like that. So really, this virtual foster concept is the idea of having a specific advocate for the dog who really, really helps that dog on their pathway. Another item that dogs at this shelter get is the potential for canine good citizen or top dog training. We know that there's research that tells us that training increases the likelihood of adoption. And so this is a program whereby dogs receive training, and you can see this little icon on the website here that once they complete the program, they get marked as top dog, or if it's CGC. So they have a little banner on their website saying that that's the case. So these can be really good programs for dogs that would benefit from a little bit of training. And there is a link with more information about CGC Ready and Top Dog program at Austin Pets Alive. These programs are all volunteer-based. And the CGC, hopefully everybody's familiar with Canine Good Citizen. The Top Dog is geared towards dogs in the shelter that might not qualify for CGC. So they might not be able to be around other dogs, but will benefit from a foundation of individualized training. The Matchmaker program, another item for our level 2 dogs. And this is a program at Austin Pets Alive that is specifically focused on big dogs, and it matches adopters who are open to a big dog. So when people come into the shelter, a lot of times people are like, say, sometimes they have specific ideas about what they want, but other times they say, you know, I'm open. I just want to find the right dog for me. And at Austin Pets Alive, those people will be directed towards big dogs that will fit their needs, because big dogs are a challenge to find homes for at Austin Pets Alive. And if that doesn't work, they of course can adopt a small dog, but it's basically encouraging people who have a little bit interest of, hey, this dog might be great for you. And this program has been very successful. Another link to that. So that's our level 2 care pathway. Our level 3 dogs are dogs who at this shelter have a known history of a behavior challenge that has been a challenge for people in a home environment. All of these dogs will be on an individualized care plan that may or may not include a behavior modification plan. These level 3 dogs oftentimes have or I should say oftentimes, always have a specific caseworker type person who helps the dog on their way. You can see they get the CGC and Top Dog. They also are eligible for life skills for long stays. This is another class at Austin Pets Alive that is focused on skills that can be beneficial for more challenging dogs. Things like crate training, things like desensitization and counter conditioning to wearing a muzzle. So basic life skills that make dogs who have specific needs be easy to live with. Pre-adoption counseling is part of a level 3 dog's care pathways. Sometimes that requires multiple visits if it's a more challenging dog, which I'll talk about on the next slide. And level 3 dogs not oftentimes, but sometimes also have a transition plan. And this is Fulton. I'm not going to show his video, but there is a link to his video. Fulton is a dog who has a sensory processing disorder. He has a long history. He's been in a home for a year now, so that's the really exciting part about him. But a long history of not being normal, or I should say, erase what I just said, a long history of being neurodiverse and being a little different than all the other dogs around him from the time he was a tiny puppy. And that resulted in more challenges as he got older, to the point where he did bite someone. And because he had some neurologic difference, we even did an MRI on this dog, which came back as normal and led us to a diagnosis of him having a sensory processing disorder, where he can easily get completely overwhelmed by things in his environment, whether it's sight, whether it's sounds, whether it's touch. Knowing this about Fulton enabled us to provide the care he needs. He has a long-term advocate. Her name is Laura Davis. And Laura Davis was able to counsel people. He's a cute teddy bear of a dog, counsel people who were interested in adopting him, and was able to transition him in a home. Because of this dog's special needs, he had something like 5 pre-adoption counseling visits. Austin Pets Alive is very, very dedicated to the dogs and their care. And I recognize that not all shelters are going to have this capability, but they were able to support Fulton in this way. And as I said, he's been happy in a home and his people love him. They just moved to Colorado a little bit ago. So transition plans, in terms of helping the animal to transition into a home in the best way possible to increase the likelihood of success, can be really valuable for our level 3 dogs. So that was a little bit of an example with regard to what a care pathway system might look like. So that was a general care pathway system, and we weren't talking about specific problems like or challenges like jumpy malady or separation anxiety or anything like that. Although obviously we can have care pathways for that. Step 3 of our system is assigning animals to care pathways. So if it's a care pathway for separation anxiety, how are we going to identify which dogs have separation anxiety? That's an important one because often dogs get inappropriately assigned to the category of separation anxiety. So at this point, as we're looking at how we're going to assign animals, we need to think about what the system is going to look like. Are we going to be assigning animals to the pathway based on historical information before the animal comes into the shelter? Are we going to look at behavior we observe in the shelter? Are we going to base it on a previously diagnosed conditions like diabetes or something like that? Are we going to base it on a trauma-informed approach, making sure that every part of our care pathway is trauma-informed? Or are we going to do all of the above? But looking at what information we're going to use to assign animals to care pathways is important. I'm going to share a little bit of information that is loosely based on the system Austin Pets Alive uses to assign their dogs to care pathways on this next slide. This was a system that the staff at Austin Pets Alive developed to assign a dog to a level 1, 2, or 3 category. So the dog gets a number. These numbers are not put on their cage or something. They're only related to assigning the dog to a care pathway and has no basis or relationship to, are we going to place the dog in a home? That's a different process. But looking at the dog type, because at Austin Pets Alive, a small dog or a puppy under 4 months of age is really easy to find a home for. That dog gets a score of 0. So I'm not going to go through all the detail here, but you can see that they look at the dog related to a number of different factors. So returns were one of them. If they have returns due to behavior, there's a score related to it. If they have a return related to a human issue or something else, they get a 0. So the dog gets a score for all of these categories, and then these get added up and the dog gets a total score. So as an example, I can't remember the details right now, but a dog who scores between 0 and 6 is a level 1 dog, and a dog who scores between 7 and 10 is a level 2. Once again, just throwing a random example. Those aren't the actual ways they use it, but they use this to initially assign the dog to a care pathway. And so that's an example. I love this picture from COVID, looking at the care pathway of life: easy, medium, hard, and as many of us remember, 2020, a whole nother level. So that was an example from Austin Pets Alive, and it's a system that has worked well for them. It's really important that they are assigning these dogs to care pathways within 2 days of intake based on the information that they have. They are revisiting and reevaluating those dogs down the road because the historical information we have may not be accurate. Things may change over time. So the reevaluation process is important. All right, implementation and evaluation. So this is our final step of our care pathway system. And part of this is getting buy-in from staff and volunteers. So we talked at the beginning about getting buy-in from leadership, and that's necessary before you develop your care pathways, because you don't want to spend a lot of time developing this care pathways only to find out it's not something you're going to be able to use. So getting buy-in, having a plan for how you're going to talk to staff about these care pathways. We want staff to be able to understand the importance of the care pathways, why they're valuable, how they're going to help us get to where we want to go. We want them to understand why they are important if they are involved in the care pathway and how they fit in and help to meet the dog's need. And when you're getting buy-in, you want to think about all the objections and challenges that people are going to ask about and have, and be prepared to answer them. One of the big things that I encourage everybody to do is to really start with a pilot program, because oftentimes there's resistance to new things. And if you talk about it related to, we're starting with a pilot program, we're going to test this out, try it out, see if it works. If it works, great, we'll expand on it. If it doesn't, then we're not. But that oftentimes encourages people when you're going to start small. And we do have a course on Maddie's University about designing and implementing a pilot program. I encourage you to check that out. Resources are crucial when we are implementing care pathways, because if we don't have, there was a lot of things that I talked about in the level 2 and the level 3 dogs. And if we don't have enough resources to be able to meet those needs, I'm still going to have them in my care pathway as a goal. And I think that's an important factor to mention, is that I may decide that dog training is really important, so I'm going to put it in my care pathway. I may not be able to do that yet because I'm still getting that program organized and up and running, but I still want it as a goal for my care pathway plan. So my care pathway plan is going to include our best practices and everything that we feel is really important for dogs to receive to help us achieve our goals. And over time, we work to make sure that we are getting all those little pieces accomplished. So when we don't have the resources, and once again, this idea of dog training, we can then plan and say, okay, what are we going to do to get the resources? Are we going to recruit volunteers? Are we going to have an external dog trainer help us with developing our training plan for dogs? So what type of resources can we find? And also really thinking about the time involved with implementing these care pathways and who's going to do it. Is there not enough time in the day to do all these things? How are we going to utilize volunteers effectively so that we can all work together to meet the dog's needs? Here is a sample care plan for Olympia, who was adopted at the beginning of the pandemic. She is one of my very favorite dogs. She was also a very complicated dog. And so this is just an example of what a care plan might look like. So Olympia is a level 3 dog. So she's on the level 3 care pathway. Olympia also has thunderstorm phobia, pretty significant, and stranger danger, or fear of strangers. So Olympia also needs care pathways for these 2 items. At the time of creating this slide, the shelter didn't have these care pathways yet, but I still had it in there because even though we didn't have the care pathway yet, we needed to make sure we were meeting her needs in this areas. And her care plan also included medicals. Olympia had a skin condition. You can see little bumps on her skin, and we need to get skin biopsies on her, really emphasizing the point that medical can impact and influence behavior. So part of her care plan also includes medical. We also felt that Olympia needed 2 pre-adoption appointments and one-on-one post-adoption support. Olympia was actually adopted by her concierge. Her virtual foster ended up adopting her, which was wonderful. And she's living her best life. So that's an example of a care plan. So when we are implementing our care pathways, we are ensuring that dogs are getting their needs met using a holistic approach, thinking about all of their needs, using our advocates. So we have certain people who are there to go and say, okay, wait a minute, what's happening with Olympia's skin biopsies? Has that been scheduled yet? So that I found that's made a huge difference in terms of helping to find homes for dogs who are not simple is using advocates who are on top of things and treating the dog as if they were their own to make sure needs are getting met. And then check-ins, regular check-ins with the team so we can talk about what's working, what's not working, what we need to change with our care pathways and with the individual plans for the dogs. So management of care pathways is important in that you saw in the care pathway example that I gave that there are a lot of different items in there. And if we're evaluating whether our care pathway is working, our care pathway might not be working because we designed a horrible care pathway or a not so good care pathway, but it also might not be working because we're not doing what we need to do because we don't have the resources yet. So this management piece of looking at the dogs and keeping track of whether they have the pieces that we need is really, really important when we are evaluating whether our program is successful. So this is a system where we use Google Data Studio to develop the system to keep track of whether needs are being met. Was really, well, for someone who likes data, this was really fun for us to develop and provided a really easy way for managers to go in and then talk to, oh, look, Fulton doesn't have a training plan and he needs one. And so go talk to Laura about, let's get a training plan started for him. So really, really helpful for managers. This is another example of management of the system. So this is Shelter Love. And the scoring system to assign dogs to general care pathways is right in Shelter Love. The shelter has a team of volunteers who review all the information about the dog initially and use the system to assign dogs to care pathways. So this is another part of management and another part of implementing the plan, making sure that you have the people, the resources, the ability to do everything that you're hoping to do. So another part of our step 4 implementation and evaluation. So that's this evaluation piece. And this is all about, so management is one thing, are the individual dogs getting what they need? Now we want to look at whether our program is successful. And so we're looking at gaps in our overall system, and that's why we developed care pathways. But now I want to look at gaps in our care pathway system to find out where we're not meeting needs and where we need to improve how we are providing care. So this is another Google Data Studio dashboard. And you can see over here on the right, I have filtered dogs by their care pathway level. So I'm only looking at level 2 and level 3 dogs that are in care here. I could also filter by length of stay if I wanted to. And this is something that managers can use and say, oh, look, 59% of dogs don't have training plans. Why is this happening? Do we need to change it, or is 59% a good goal? So looking at all these individual items and looking at, are only 36% of level 2 and 3 dogs getting top dog CDC because that's all who needs it? The answer to that is no. All of these level 2 and 3 dogs would benefit from training. Is it because some of them have already passed? That certainly could be the case. But looking at this and saying, okay, so we are not meeting needs here. Do we need more trainers? Do we need more staff? What do we need to meet this goal? And being able to recognize that right now I can't assess whether this care pathway is effective because there's so many situations. 18% at the time of this of animals didn't have a bio on the website. And so it helps us to evaluate where we're not meeting needs, and then decide it. We may decide after, if we've been going on for 2 months and we're still staying really low in terms of not having top dog and CGC training, we may decide, what, we've tried. This is a goal that is not achievable for us at this point in time, and we need to figure out how to meet this need in some other way or decide to do something different. I hope that makes sense. So evaluation helps us to tell us where we are so that we can find and fix those cracks in the program and put everything back together, and then truly be able to determine whether this program is actually helping the animals or not. And hopefully it is. And sometimes we just need to do a little bit of fine tuning. Other times we may have created a plan that is just not working for our systems. I want to talk briefly about welfare and safety considerations. So when we're talking about dogs who have been in the shelter for a long period of time, part of our care pathway system includes an evaluation of behavioral health and other factors, and looking at items to evaluate welfare, quality of life, to make sure that we're meeting the dog's needs and working to very actively and urgently change things when dogs or cats are challenged. And also thinking about making those difficult decisions when you need to. So we can have a checklist that's propagated from information that we have about the dog, like length of stay, number of adoptions, why the dog's been returned, things like that, that help us to gather all the information together in one place to help make a decision about the dog, whether we feel the dog is still safe to place. And thinking about things like, what is this dog like most of the time? Are there behaviors that are very, very concerning? So having checklists and forms to look at these different factors to help to evaluate the individual dog. And it's almost like a safety check for our care pathways to ensure that we're doing everything possible to meet needs. So that is my quick introduction to care pathways. I hope that this has encouraged you to be somewhat interested in starting care pathways for the animals in your care. If you're not doing them, if you already have them, maybe think about using them more for behavior. If you're not doing that, I'm very passionate about this topic and love talking about it. So I encourage you all to join me on this journey in terms of doing better for our animals, always striving to do more, because they're definitely worth it. This is Gwen Stefani and her mom. Gwen had quite a long history and many challenges along the way, but has been in a home environment for a very long time now and doing wonderfully. I want to end by letting you know that there is a Care Pathways course at Maddie's University that will walk you through the process of creating care pathways for animals at your shelter. The care pathways can be about behavior, and I love behavior. Love if people are joining the course are doing it for that reason, but it could also be veterinary care as well. It really could be anything that you want. But by the end of this course, the goal is that you will have care pathways to start, or a care pathway to start at your organization. So that is it for me. Thank you all very much, and look forward to answering any questions that you may have.
Thank you so much, Dr. Segerson. We have a few questions in the Q&A. The first one is, how are these levels tracked in a shelter operation system?
So I think you probably got the answer to that system, but I'm just going to clarify. The shelter with that particular system uses Shelter Love, and they use one of the behavior modules. I think it's behavior assessment, although I can't remember for sure right now. And that's where the animal gets scored. And then there are a number of different ways in Shelter Love, which is the shelter software I'm most familiar with, that you can assign categories to. And so some people use them to assign playgroup categories or other types of things. So this shelter used a category that assigned dogs to the levels so that I could then go into the system and, okay, I just want to look at all level 1 dogs in my shelter. And I just click on a button and filter by all level 1 dogs. And that allows me to see them all. I hope that answers your question.
Our next question is, can dogs move up and down from the levels, or can it only increase in level depending on their welfare?
Excellent question. They can definitely move up or down. So a dog might come into the shelter as a jumpy, mouthy, excitable dog. And so the dog is level 2. But once we provide that dog with training, give it the enrichment that they need, give that dog an advocate to give it a little extra exercise, that dog can certainly move down to a level 1. Or the dog could, that despite everything that we're doing, become more and more stressed and frustrated in the shelter and move up to level 3. So these are definitely, for this system at least, flexible systems. And one of the goals is, if we're trying to meet individual needs, that as the dogs change, we all change over time, their levels might change as well.
Awesome. And then the next one is kind of a personal question, but I imagine that that it could be, you could take it either way. So Ellis wants to know if it's possible to receive a template or access to the dashboard. They are APA's data person.
Hi, Ellis. Yes, I would love to give you access to this. That dashboard is something that has not been used by APA probably in about 2 years now, but I would love to get it going again. And if there's anybody else who wants to check it out, I will share it in Maddie's Pet Forum, share access to the dashboard. I do encourage everybody, if you're not on Maddie's Pet Forum, please join the forum. And as you're thinking about things after this webcast, if you have questions, please go to the forum. I'll be there to answer it.
All right. Well, thank you all so much. If you have questions, you want to discuss this more, we'll be on Maddie's Pet Forum. We really appreciate you coming and hanging out with us today.
All right. Thank you.
Yes. And thank you so much, Dr. Sigerson, for your presentation and for all of this wonderful information. We really appreciate it.